New guidelines on a procedure that can detect cervical cancer is causing some worry. Medical groups now say most women can wait up to 5 years to get a pap smear. The previous recommendation was every 3 years. Shortly before that, it was every year. Now, some women are worried that if they wait longer to get tested, they could miss a chance to spot cancer early. Dr. Jessica Shepard is here. She's an OB-GYN. She's also the assistant professor of clinical obstetrics and gynecology at University of Illinois College of Medicine at Chicago. I'm glad you're here to talk about this.
Thanks so much, Anne-Marie.
So listen, first things first.
Yes.
When should you be going to get your first pap smear? I remember, I thought it was when you first became sexually active, but what is it?
Used to be 18 years old, and again, like you said, when you first became sexually active, but we've now pushed that back to 21 years old.
Really?
Yes, and most people are not aware of that, and so they show up before they're 21, and I'm like, you can come back when you're 21, so 21 years old.
So why the change in the guidelines now? 5 years seems like a long time.
It does, it actually does. But what we've found through evidence-based medicine is that we were actually over-treating, being very aggressive. And what we found is that if you have a negative pap smear, and you are negative HPV. Now, we all know that HPV, which is human papillomavirus, is the leading cause of cervical cancer. So if you're not exposed to that and that's not showing up on your pap smear, that's why we extended those guidelines, because the chance of you being exposed and showing up with invasive cervical cancer, those were really low and rare. So we were able to spread those guidelines out and again have pap smears now every 5 years rather than every year or every 3 years. Okay. But you have to make sure that people realize that it's negative pap smears or no exposure to HPV that allows you to go by those guidelines. Okay. Now, if it's different, it's going to be every year that you should visit your gynecologist.
Okay, so if you have been exposed to the human papillomavirus,
yes,
you should probably go
changes the recommendations. Yeah.
Okay, so I'm sure there are a lot of women that are celebrating,
yes,
right?
Yes.
But there are other women that are very concerned. It seems like 5 years is a long time to wait. That's
right.
Twice a decade.
Yeah.
There's a concern that if there is a cancer growing, that by 5 years you could be in trouble.
Right, and so that's the thing, is that women need to realize is that every 5 years, that is the recommendation, but that's based on studies that we've done on how quickly cervical cancer will appear, how quickly it will grow and become invasive. And so that's why they've been able to do that. And even when it was every 3 years, what they did find is when women came back every 3 years, they still wasn't much change. So they were able to push that back to every 5 years.
Okay, so you're okay?
Yeah.
Okay.
You're okay. Being negative.
So
no HPV exposure.
So if you are one of those people that say, great, see you in 5 years, doc.
Yeah.
Is that a good idea, seeing your OB-GYN every 5 years?
See, that's how we have to change the culture, that pap smear is always affiliated with your gynecologist.
Yes.
That's what you went to your gynecologist for, is just your pap smear. But there are so many other things that encompass that well-woman exam, whether it's talking about the mammogram, STD testing, family planning, that's before you get pregnant. You should be talking to your doctor about what should I do when I get pregnant, and also contraceptive counseling. There's so many other things that encompass that visit that you really should go every year, see your doctor, get screened for other diseases and other things, and also establish a relationship with your gynecologist.
I think most women, associate their gynecologist with a pap smear, and then if they're already pregnant, and it's not a good association typically, and so you try to avoid seeing your OB-GYN as much as possible. Not a good idea, though.
No, we really should foster a relationship with your gynecologist. And so when you go to your gynecologist, you want to know, is this someone who I want to come and talk to every year? Someone who I want to talk to about the things that necessarily you don't want to talk to your doctor about. But as a female, you really want to establish that relationship. Well-woman exam is what we really want to establish, rather than the scary pap smear. Yes.
And you were mentioning that there are a lot more OB-GYNs who are women now.
Yes, and that is something that should really foster that relationship. Before, it used to be a male-dominated field, and now we're having more females being OB-GYNs, and so that should actually help. That should make women feel more comfortable with discussing the female pelvic issues that before we necessarily didn't bring up all the time.
Right. So let's go back to this policy change, this every 5 years.
Yes.
Should I be concerned about my insurance? Are they going to stop covering yearly exams?
Great question. And the thing that we found is it has not changed as far as coverage. And this is something that we should pay attention to. Now, it may come up in the future. Healthcare policymakers, that's something that they might consider. But as for right now, it really is covered. And again, I think the reason why it hasn't changed is because there are still reasons to go to your gynecologist every year. Even though the recommendations for a pap smear now have changed, there's still other things that encompass the well woman exam.
All right, Dr. Jessica Shepard, thanks for joining us this morning.
Thank you so much.